Ask the Doctor by GPDQ. Expert medical advice for you, your family and your colleagues.
Hi, this is Lucas, and we have our clinical director with us today, Dr Kathrina. Hello.
Hi, Lucas.
Hello, hello. And we're going to talk about other alternative diagnoses to COVID. So basically, if it's not COVID, what is it? And I know that you're not feeling very well today, so being a bit under the weather. So what's going on with you?
So yeah, Lucas, I'm not feeling very well. I've had a sore throat. I've lost my appetite. My smell is absolutely fine. I don't have a temperature or a cough, but I do have kind of sweats and a little bit of a body ache, and just kind of generally feeling tired. I've also done 2 lateral flow tests and I've got a negative PCR test. And this is not an uncommon situation for patients to be faced with, and doctors as well. It's kind of a common scenario where someone's feeling a little bit unwell. They've got some symptoms, maybe not the main symptoms of COVID. They've got some negative tests, and then the scenario is, what do you do next?
Yeah. So could you just remind us of main symptoms of COVID?
Yeah, definitely. So the main symptoms, and we know about them, they're the cough, the change to your sense of smell or taste, or a new temperature. They're the ones that have been drilled into us. They're the ones that we know really well. But there are some other symptoms which we did a video on before. Those symptoms are also very common. So a sore throat, a runny nose, maybe sneezing, headache, GI symptoms, rash, body sweats, and aches. So there's lots of symptoms of COVID. Some of them do overlap with other illnesses. So it can be a little bit tricky trying to figure out, if it's not COVID, then what is it?
Yeah. So what actually are the other possible diagnoses?
Thanks, Lucas. So it's a tricky question because there are a lot of alternative diagnoses. Firstly, I think it is just worth mentioning that if it's not COVID, as in you get a negative test, an alternative diagnosis, it could be that it still could be COVID. So we know that tests can be falsely negative, for example, and that is something we should be aware of, just not to be too easily reassured. So to reduce the risk of getting a false negative test, we have to make sure that we do the lateral flow tests properly, so reading the instructions and kind of trying to follow them to the T, so not eating and drinking beforehand, using the right amount of drops, etc. And if you do a PCR, just being aware that they are more sensitive than the lateral flows, but could also be falsely negative. So that's kind of the first differential, if you like. If it's not COVID, still could be COVID. But other things to include, firstly, the common cold. I think that's probably the first thing that has got symptoms that cross over the most with COVID. So with a common cold, you could have similar symptoms. So a cough, a runny nose, fever, body aches, chills, headaches. And it's quite difficult to tell them apart clinically. The symptom that is more unique to COVID would be the loss of sense of smell or taste, or change to your sense of smell or taste. But otherwise, it's quite tricky to tell the symptoms apart. Other diagnoses, so kind of specifically for a cough, the other diagnoses could be, if it's a dry cough, it could be the common cold again, could be asthma, especially if you've got wheeze as well, could be COPD, could be just an allergy. And if you've got sputum, so if your cough isn't dry, then it could be a bacterial cough. And if the cough is going on for more than 3 weeks, it could be other diagnoses. So I think if you're unsure and the cough is not dry, then speak to a doctor. Yeah. Or if you've got shortness of breath or difficulty breathing, something like that, speak to the doctor.
Would you be still sort of continuously testing yourself?
So it's a tricky question. I don't think that there's any right or wrong on this. If you get negative tests initially, we're told that you're out of isolation, if you like. But for example, in my scenario, I will retest myself just to be certain, and I'm working from home anyway. So I think that that's part of the equation, is being slightly comfortable with the grey, and as if, I'm not 100% sure that what I've got, for example, isn't COVID, even though it doesn't seem that way. But in any case, I'm just going to kind of drink fluids and do the right things and isolate myself from other people whilst working from home and retest, because it still could be.
Yeah, sure.
Yeah, does that make sense? So you
No,
kind
yeah,
of,
absolutely. Yeah, totally. Yeah, obviously, yeah, we just have to be cautious. I think that's probably what the message is, and we
exactly,
do the right things from every angle.
yeah, just covering bases and being aware of the other possible diagnoses that are there.
Yeah, and other people as well. Okay, thank you ever so much. It's obviously super valuable. Do tell your friends, and remember this week to put yourself and your health first, as usual. Thanks
Perfect.
all.
Thanks, Lucas.